Have you ever heard of natto? It's a traditional Japanese breakfast food. And what if I told you it might hold a clue, a fascinating one to improving cancer care? Today, we're going to unpack some really compelling, though indirect, evidence linking this food to a critical aspect of cancer. So let's dive in.
So here's the big question, right? Can this fermented soybean dish, a staple over in Japan, actually play a meaningful role in a complementary cancer strategy? It's a huge question, and you know what? The indirect evidence we're about to walk through is surprisingly powerful.
Okay, so first things first, let's get our terms straight. You've got natto, which is the food itself. But the real star of the show for researchers, the thing they're really focused on, is nattokinase. That's the active enzyme inside the natto. And that's what you'll find in supplements and what all the clinical studies are about.
All right, so to even begin to understand the potential cancer connection, we first have to look at what we already know for sure about nattokinase. We've got to explore its established effects on our vascular health, because honestly, this is the foundation for everything else we're going to talk about.
So the science here is pretty solid. Nattokinase essentially makes our blood less sticky. It does this in a few ways. It keeps platelets from clumping up, it helps dissolve clots that are already there, it lowers key things that cause clotting, and it even makes the blood itself, physically thinner.
And that word right there, sticky, that is the absolute key. It's the bridge that connects blood health directly to cancer. So why on earth does having sticky blood matter so much when we're talking about metastasis? The way cancer spreads through the body.
Let's try a little analogy here, just to make this super clear. I want you to picture cancer cells that have broken off from the main tumor. Think of them like little travelers, and they're trying to navigate the body's superhighway system, which is our bloodstream, to set up shop somewhere new.
Okay, so if that highway, the bloodstream, is sticky, it's full of obstacles. Think of tiny little blood clots and activated platelets as patches of Velcro all along the road. This stickiness gets ramped up by a substance called thromboxane, which basically creates the perfect grab-and-go environment for these traveling cancer cells.
And this is the critical part of the journey. By grabbing onto one of these Velcro roadblocks, the cancer cell can literally pull itself to the side of the road, exit the bloodstream, and invade a new part of the body to start a new tumor. So it makes sense that a less sticky highway would make this whole process a lot tougher for them, right?
So nattokinase, on its own, makes blood less sticky. That's interesting, right? But believe it or not, the research gets even more compelling when it's combined with another compound, red yeast rice. It seems like these two together create a synergy that just massively amplifies the effect.
So how big of a deal is this? Get this. Clinical trials show that this specific combination can cut the levels of thromboxane B2, that's that key stickiness marker we talked about, in half, a 50% reduction. That is a huge drop, and it's way more than either one of them can do by itself. And the good news doesn't stop with just stickiness. Look at these numbers from a Taiwanese study. They show a major impact on overall vascular health. The number that just jumps off the page is the LDL cholesterol, the bad kind, which plummeted by an incredible 41%. We're also seeing big drops in total cholesterol and triglycerides, and hey, even a nice little bump up in the good HDL cholesterol.
Okay, but here's the catch. And it's a really, really important one. To get these kinds of amazing results, the research is crystal clear on one thing: the dose is everything. It's not enough to just take some nattokinase. The amount you take is absolutely critical. This slide just lays it all out plain and simple. In a big study with over 1,000 people, they tested 2 different doses. They're measured in something called fibrinolytic units, or FU, which is just a fancy way of measuring the enzyme's clot-busting power. At the lower dose, 3,600 FU, basically nothing happened. But when they tripled it to 10,800 FU, the results were night and day. It really worked.
And just how effective are we talking? Well, we're not just talking about numbers on a page. These are real, physical changes happening in people's bodies. The study saw major reductions in how thick the carotid artery wall was, and even in the actual size of the plaque built up inside. The improvement rates were just massive, from over 66% to almost 96%. That's a huge, tangible impact.
Okay, so let's pull all of this together. We've seen how nattokinase works on the blood, the incredible synergy with red yeast rice, and how crucial the dosage is. So after all that, where do we land? What's the final verdict on all this indirect evidence?
The research analysis that this explainer is based on gave this body of evidence a rating of 2.9.
Now, on their particular scale for indirect evidence, that's the highest score you can possibly get. It's their way of saying, hey, even though these aren't to our cancer trials, the supporting evidence connecting the dots is as strong and relevant as it gets.
And the reason they give it such a top-tier rating is actually pretty logical when you think about it. It's because the powerful cardiovascular results we've been looking at directly affect the very same things, those biomarkers like platelet activation and thromboxane levels that are already known to be deeply involved in how cancer grows and spreads.
And hey, don't just take my word for it. The analysis itself puts it perfectly. It says, with the very close association to increased cancer progression and metastatic spread, we find clear motivation to support our rating of 2.9. It's hard to get a stronger statement about the power of this connection. So the bottom line is, what does this all mean for you? Think of this information as a tool to help you have a smarter, more informed conversation with your doctor. This is absolutely 100% not a replacement for any medical treatment. It's simply a compelling topic to discuss as part of a holistic, complementary approach to your health. And one last thing, and this is without a doubt the most important point of this entire explainer. This is for educational purposes only. It is not medical advice. You should always consult your oncologist or your healthcare provider before you start any new supplement of any kind. Your medical team needs the full picture to give you the safest and best care possible. Thanks for watching.